Straight back into the conversation, Stephen Powell.
I was there in 78, 79. I was the General Secretary of the Middlesex branch of the Confederation of Health Service Employees.
Yeah.
In fact, there's just been a TV series about the Winter of Discontent, which features me with a auburn beard and some long flowing hair, looking, if I may say, rather magnificent. But what we did at the Middlesex Hospital was, at the porters, first of all, we met with them and we agreed that we'd cover meals and the mortuary. We'd actually have a skeleton crew there. The nurses, and nurses weren't all in the RCN, quite a few of them were in COSI, a few of them were in UP. There was a basic cover within the hospital. And then we met David Owen, and David Owen, I think, was the health secretary at the time, and he said, don't forget, after the general strike in 1926, you had 20 years of the Conservatives. If you all go out this winter, there'll be 20 years of the Conservatives. He was wrong. It was 19 years.
Exactly.
So I think you have to be a bit subtle. I mean, a strike is a pretty blunt instrument, and I think what we did at the Middlesex back in 78, 79, to actually say we're making the point, because it was the time of the 4% norm for all that nonsense. We're making that, but we are not going to put patients' lives at risk. We're actually going to make the point. We're going to picket the hospitals. We're going to be outside there making the point, but also going on television, going on the radio and expressing the case. When Ella talked about 15%, in factual fact, nurses need 17% because they've lost 15% over the last few years. We've got £183 billion a year goes into the health service, and it is in crisis. It is creaking at the seams. It's not working. Please, if there's one thing that can come out of this, one good thing, is there's got to be some sort of a national consensus on what kind of health service we want. And I appreciate this is not your general point. You're talking about the strikes, but the health service is a special case.
That's Stephen Powell. He's going to be with it.